Some of the audience already know me. I was here, I think, a couple of months back giving a talk on fatty liver in South Asians. Can you actually hear me without the mic?
I think it would be good to have them.
Okay. So, Sridhar asked me to talk about some general topics in healthcare in South Asians. Ideal topics would be things like heart disease and diabetes. Unfortunately, I'm a gastroenterologist, so I will give you some of the statistics. So I'll give you a couple of statistics, right? So I'll give you a couple of statistics in South Asians, and then I'll open up for questions. I'll talk about common GI, gastroenterology topics, and if you have any questions, feel free to ask me, okay? So some of the statistics in heart and diabetes in South Asians tell us that South Asians are at risk for 3 times more increased risk for heart disease and 4 times increased risk of diabetes compared to average American population, okay? And if you look at the overall statistics for heart disease, less than up to 50% of Indians can expect the first heart attack less than 55 years. So which means that if you're under 55, the statistics are telling us that you will probably expect to get your first heart attack 50% of the time. That statistics is pretty bad because what it's telling us that our genetics we can't change. And then the other things are already risk to something called metabolic syndrome. So if you look at the global statistics of heart disease, 60% of current coronary artery disease patients are coming from South Asia. So that's a huge number. So if you look at each of your family members, you'll find out that at least one of them will have either diabetes or heart disease at a young age. And in fact, it happens in my family where, my uncles, they had some diabetes at a young age. If you look at my sister's family, they have some heart disease at a young age. But the overall statistics are telling us that the Indians are at very high risk for all these things. Now, what actually happens in Indians population is you have genetics that you can't change. And then you have this, what's called metabolic syndrome. Now, what is metabolic syndrome is? It's a combination of obesity, high triglycerides. So when you look at your cholesterol profile, you'll see that it comes back as a couple of numbers. So it's high triglycerides greater than 150, low HDL, which is a good cholesterol, very high LDL, which is bad cholesterol, or actually in Indians, the LDL could be normal, but it's a subcategory of LDL called small particle LDL, which is very atherogenic, which means that it starts plaquing the coronary blood vessels. So that's high in Indians. And then sugar. So anytime the fasting glucose is more than 100, so if you add all these things, high cholesterol, low good cholesterol, obesity, sugar, and hypertension defined by blood pressure greater than 130/85. So that becomes a metabolic syndrome. So the metabolic syndrome is happening because you have what's called insulin resistance. So the insulin that comes from your pancreas is not working properly in places where it's supposed to act. And insulin is again an atherogenic particle. So normally what happens is the insulin goes into your peripheral tissues, it tries to regulate your glucose, and then if you have insulin resistance, rather than utilizing the glucose properly by the muscles and other cells, it directs back into your liver. So one of the complications of that is fatty liver. So I talk about fatty liver a lot in my medical community. So where the excess glucose goes back into the liver, and then the liver converts that into fat and stores it. As the liver is storing fat in the liver, other things are happening in your blood vessels where this insulin is making this bad cholesterols and sticky cholesterol go into your coronary blood vessels and cause atherosclerosis. So that's one, again, risk factor where we see that fatty liver, atherosclerosis, diabetes, pre-diabetes, increase risk. And then we see that as you become, as you come into the 40s and 50s, it increases the risk of coronary artery disease. So the treatment or prevention or the risk factors are just actually doing the opposite. So if you look at all the metabolic syndrome, the treatment for that is diet, exercise, weight loss. That's the same thing I tell my patients when I see fatty liver in them. So the treatment is again diet, exercise, weight loss. There's no magic medicine for that. Now, if you have high triglycerides or high cholesterol, then obviously you need to control that very aggressively. Taking a baby aspirin to prevent atherosclerosis or making the blood thinner is obviously a common concept, that we talk about people in elderly population. So coming back to diet, exercise, weight loss. So what is exercise? Exercise, to start off very simple, you can say aerobic exercise, 30 minutes a day, 5 days a week. Now that 30 minutes could be walking in your office, you can use a pedometer. So what I usually do in our South Asian population is, one of my colleagues who runs a South Asian center called Prana. So I recommend everybody, if you have time, to log on to the website and look at the Prana website. So there's a simple calculator there, how to calculate your BMI and what is a high BMI and how much of exercise do you need and what type of nutrition, diets, are very helpful for you. So I'll touch on a few of these things very briefly. So BMI is basically body mass index. So it's a calculation that you make based on your height and weight. So these calculators are available all over the internet. So in Indians, it's unlike American population where if it's greater than 25, we say overweight, greater than 30, we say obese, and then greater than 35, morbidly obese, and 40 is super obese. So in Indians, it's actually less because we don't see people weighing BMIs of 40s anymore. So, but then the BMI of 23.1 or less than 25 is also a risk factor. So a shorter BMI increases risk of atherosclerosis. Okay. And then when coming back to exercise, the 30 minutes, I usually tell patients you can use a pedometer. So you have an application that you can download from Apple, and then you can use that, how many steps you're walking. And each day or each week, you can increase your number of steps, 10,000 being an ideal step. So meaning, you can use your steps and say how many steps you're walking in a day. And as a guideline, if you go up to 10,000 steps, that's a good start. Okay. Now coming to diet, there's a lot of things written in South Asian diet. Now the biggest culprit is the high carb diet. So we see that high carbs not only are associated with more refined sugars. Okay. So when I say refined sugars, these are things like white bread, pasta, and white rice. Okay. So and then the quantities. So we are the science of diet and exercises is just going into small portions more frequently and substituting all these carbs with more protein and vegetables and nuts. Okay, so if you go and speak to primary care physicians, they'll concentrate a lot that the future of diet is going into low calorie, so which is the golden thing to lose weight and have a prolonged life, and then low carb diet. So low carb would be substituting white rice to brown rice, for example. Okay, because that has a complex carbohydrate. So what happens there is the insulin surge that happens right after a meal is decreased. So you don't have a sudden bump in insulin that needs to be generated to digest your high sugars that happen when you eat simple white carbohydrates. Okay, so brown rice, things like soy or pasta, soy pasta or brown pasta, those kind of things, and eating more fruits and vegetables, increasing the servings of all these things while cutting back the quantity of each one of the things is one of the main reasons why you want to cultivate as a good habit there. Okay. Now coming back to some of the general GI topics that I usually see in Indian population is obviously acid reflux is very common. Okay. We call that gastroesophageal reflux disease. That's very common. The other common things are gas and bloat. So I'll touch a little bit on GERD. So GERD is acid reflux disease. So the common mechanisms of GERD are, so right in the esophagus, where the esophagus meets the stomach, there's a sphincter. That sphincter relaxes transiently. Okay. So when the muscle relaxes, you get your normal acid go up into your chest. And that's the most common mechanism of getting heartburn, acid reflux. Now, everybody must have noticed a little bit of heartburn once in a week or once in a month, at sometimes. The statistics tell you that up to 30% of population or 30% of adults have at least one heartburn once in a week or at least a couple of times in a month. Not necessarily that every one of these people should be treated. So what happens there is, then the symptoms gradually tend to progress. So then we talk about what can you do to prevent those kind of things. So again, same thing. The risk factors for acid reflux are obviously smoking, being overweight, eating too much, and eating too much too soon or too fast, and then sleeping right after eating food. Okay, lying down flat when you sleep at nighttime, and then eating the wrong foods, which are usually more oily, greasy, fatty, and things like too much chocolate, coffee, alcohol. Okay, doesn't mean that you stop all these food items though. And in each any particular individual, notice that there's a balance. So you figure out that I can manage a little bit of one cup of coffee if I'm doing 3 cups, but I can manage my symptoms. But at other times, you'll see that you might need some medicines. So when you talk about acid reflux, these are the risk factors. So lifestyle modification is number one, meaning you can control most of these acid reflux symptoms by diet, exercise, weight loss, eating the right foods, cutting back the risk factors and all that. But a majority of them notice that initially 10 years ago they used to get once in a month, and now they're getting a couple of times in a week, and now they have to start taking some over-the-counter medications. So the next thing we talk about acid reflux would be a step ladder pattern. So lifestyle would be number one. The number two would be use of antacids. Everybody must have used some antacids like Tums, Maalox, Mylanta, all that kind of stuff. That works only for 30 minutes. So when you take Tums, you're basically coating the stomach lining, and then the acid neutralizes with the alkali, which is the Tums, and then in 30 minutes it washes off. So anytime you get symptoms more than that, or if you need better or longer lasting control, that class of medicines doesn't work. And then from there we go to what's called H2 blockers, which is histamine blockers or Zantac or Pepcid. Okay? So Zantac and Pepcid works for 12 hours. So if you want a little bit more longer control, you take Zantac or Pepcid, which are both similar class of drugs, one tablet twice a day. Okay? And then after that, you get to what's called the biggest class, proton pump inhibitors. Now, you must have heard drugs like Nexium, Prilosec, Omeprazole, Aciphex, Rabiprazole, and all that kind of stuff. They all come into this proton pump drugs. Now, what the proton pump inhibitors do is, there's a final step in acid secretion in the stomach called proton pump inhibition. These proton pumps are active when you are in empty stomach, when the acid secretion is very high early in the morning. And then when you block them by taking this medicine on an empty stomach half an hour before breakfast, the pumps are deactivated for the whole day. And when you do that, your normal acid-induced digestion and all that kind of stuff is not compromised, but there are symptoms related to high acid or symptoms related to hypersecretion of acid is diminished, and your symptoms are better controlled. Now, those classes go from once a day and twice a day to the more severe cases. Now, anybody, when he's taking once a day and twice a day, if he's taking any of these medicines over a rapid span of time, like within 3 to 6 months, then I don't believe them, because you can't have acid reflux go from nothing to dietary adjustment to once a day to twice a day, all within 3 to 6 months. Remember, this is a chronic condition. It goes on initially a couple of years, very temporarily going up as needed medications, and then gradually to once a day, twice a day. If anybody is taking these medicine on a chronic basis, then I usually say you should see your primary care physician or your gastroenterologist, because now we start talking about any complications like irritation of the esophagus. There's a condition called Barrett's esophagus, which is a precancerous condition that can damage the lining and then increase risk of carcinoma of the lower esophagus. That too is not common in our Asian population. It's more common in Caucasian population. So I don't do endoscopies, in this kind of setting, because endoscopy is usually not helpful in the beginning in any of these conditions. It's usually more helpful in person who uses medicines and is, despite using medications, he's symptomatic, or if he has an ulcer-like symptom or severe inflammation that's not controlled by medications. Okay? So that's on acid reflux, and I can open up for any questions on that. The other common things that I see is gas and bloat. So gas and bloat is extremely common condition in Indians. Now, almost like in a week, I would get 5 to 10 consults, okay, on that. Now, the reason gas and bloat is so common is it's lifestyle again. Okay, so I'll tell you some of the common ways we handle gas and bloat. So if you see gas, bloating, and excess burping, these kind of issues, if you look at the physiology of that, everybody has lots of gas in the body. Most of it's absorbed in the body, and then it's excreted, or you burp it once in a while. But then the problems with people who complain to us with gas and bloating are, one, it can come from diet. If people have a habit of snoring, what's happening is when they snore, accidentally you're swallowing the air. And that air next day is retained in the stomach, and it takes a long time to diffuse out. So you'll feel that people who snore a lot, the next day morning, they feel bloated, they feel tired, they feel more fatigued. Well, if you're having any of those symptoms, you should talk to your primary care physician, because you probably are heading towards sleep apnea. That's one important clinical findings telling us that something else is going on. But from a GI perspective, you're swallowing air. So when you swallow air, the next day you're bloated. Okay? The next common cause is diet. If people are drinking lots of milk, one of the common misconception is milk is good for everything, but then milk is lactose. As we love to drink milk, the bacteria in your colon, they digest your milk and they love it, because they secrete lots of gases. When the milk gets digested, you need an enzyme called lactase. If you lack lactase for whatever reason, most Indians sometimes they have primary lactase deficiency. Sometimes when they travel, when they get gastroenteritis, they got what's called secondary lactose insufficiency. That's temporary, that they recover from that. But during the process, they get lots of gas and bloating. So then what happens when they drink milk, the bacteria produce a lot of gases from that, and then they get more bloating. And then the third part is diet rich in gassy vegetables, or beans, broccoli, cauliflower, lettuce, asparagus, lots of Mexican diet and things like that, or dal, you know, in too much excess. They feel that then they cause lots of gases. Drinking alcohol or chewing lots of gum, because chewing lots of gum has sorbitol in that. So similarly, it goes into their bowel and then causes lots of gases. Okay, so those are the dietary causes of excess gas. Now I have a whole list of things that produce more gases. If you go to our website, I think on Prana or any other Google website, there are classic few vegetables and fruits like apples and peaches and stuff like that. They produce more gases. Okay. So apart from that, then other common causes of gas is your body producing a lot of gases. So very commonly what happens is there is a condition called irritable bowel syndrome and a similar other condition called small bowel bacteria overgrowth, which means that in these conditions, your colon or your small intestine is getting more number of bacteria translocated from your colon back into your small intestine. And in these people, it's again silent because you're not dying from this, you're not having any ulcer symptoms, you're not having any bleeding, you're not having any weight loss and all that kind of stuff, but you just find yourself that very bloated throughout the whole day. In those people, we do a breath study. You know, it's a very simple test. You just blow into a tube, you get a sugar to drink, and then you blow into the tube every 30 minutes. And we were looking at rise in gases earlier on. If you get those rise in gases earlier on, it's a positive test for small bowel bacteria overgrowth. So as the word says, it's in the small bowel, it's one before the colon, bacteria overgrowth. And then those people are treated with a course of antibiotics. The common antibiotics are things like Flagyl and rifaximin. These are two different common medications. Now, irritable bowel syndrome is the other most common condition. Now, irritable bowel syndrome is widespread, especially in younger population, both sexes. We talk about females more than males. This condition is such that something happens, you know, it's a personality. Usually it can run in family, usually it can run if people have anxiety, depression, other associated conditions. The way people present is, they always have some sensitive issues. They have some sensitive stomach. Their stomach is always kind of upset when they travel, when they go on a flight, when they take antibiotics, when they're in a stressful situation, before exams. So this kind of history goes on for many years. And then when they come to see us, they say that this has been going on, I used to manage it, you know, I drink this, I drink that, and things are quiet. But then after a while, you know, they get more of these symptoms. What happens here is your small intestine, which is beyond the stomach, becomes very sensitive. It becomes sensitive to distension. So when it distends, the muscle of the wall contracts, and then signals get generated, and those signals are transmitted rapidly to the brain. The brain processes them, and then sends signals back to your bowel to feel it as discomfort. So this cycle goes on, and that discomfort is highly variable across the board. In some people, it's like occasional cramp, gas, bloat. In some of the people, it's diarrhea. In some of the people, it's periods of constipation followed by diarrhea, like urge to go to the bathroom right after eating food. That means that it's getting very sensitive, and then they run into all these kind of situations. So we tackle that by blocking these signals wherever they are. We don't block the signals in the brain initially because that's by use of antidepressants and all that kind of stuff, so they have after effects. So we try to do simple ways by controlling gas and bloating, eating the right foods, eating yogurt, taking what's called probiotics, which are yogurt, which are good bacteria in a capsule. Those are strain specific. Now, if you go to grocery store, you'll see 155 varieties of probiotics. That's because that's the hottest business right now. Because you open up a probiotic, everybody is into it, and then they can sell it. Each one is strain specific though, so you want to read a little bit, and you want to give it about 2 weeks of time when you do that, because you are trying to build up good bacteria for the 2 weeks to suppress the bad bacteria and see if there's a beneficial effect. Okay, so that you use probiotics. We use yogurt, homemade yogurt, things like Danone, Activa, Yakult, Kefir. You know, any of those things work. Sometimes we give another herbal medicine called peppermint oil. Peppermint oil is basically a smooth muscle relaxant. So what happens is when you take a peppermint oil in the form of a capsule, you're relaxing the smooth muscle, which thereby relaxes the distension caused by gases. And not all of them, about 40% get some symptomatic control, okay? And then obviously high fiber diet and avoiding food items that increase gases and all that kind of stuff, okay? Now, when somebody has these kind of gas bloat symptoms, we obviously try to rule out major risk factors. So if they have these things with nausea, vomiting, if they have this with severe abdominal pain which is unexplained, or bleeding, or anemia, or weight loss, or family history of pancreatic cancers, stuff like that, then we say, you know what, we should do a CT scan or other things, or an endoscopy or other things to follow up with more serious things. But if they have none of those things, 99% of the time, you don't need a single procedure. Okay? You don't need a single procedure. You can use common sense and say you all come under this category of patients where it's either lactose intolerance, it's small bowel bacteria overgrowth, it's irritable bowel syndrome. The other thing is gluten sensitivity, which is very common too. It's more common in the Caucasian population. Now, when I say gluten, gluten is basically wheat. It's a protein that's seen in wheat, barley, oats, multi-grains and all that. And it's extremely common not to avoid it because it's present in basically every single item. So a lot of people, when they have too much of gluten, like too much of breads and pastas and all that, they sometimes feel that they feel more gassy and bloated. So that's another reason why we say come down on the gluten intake. Now, a serious form of that is celiac disease, where now you're allergic to this gluten, your body just can't digest that, okay? Fortunately, that's not that common in Indians. So I wouldn't say everybody who comes in with gas and bloating check for celiac disease. No, it's all after ruling out, all the other things, okay? And then there's another one called gluten sensitivity, which is what I was talking about. If you don't have celiac disease, if you're sensitive to lots of breads and grains, it's actually gluten sensitivity. In those people, we cut down the grain intake, the wheat and the breads and all that kind of stuff, go to brown rice, go to lots of fruits and vegetables, and then, those kind of things will improve the symptoms, okay? So this is actually, in brief, management of gas, bloat, what causes gas and bloat, what are the warning signs, and what are the more benign signs. And the benign signs are one of these common things. And if anybody suspects lactose intolerance, the easiest way to treat that is come off dairy for 2 weeks and try lactose-free or lactate milk, that's available anywhere. If you use it for 2 weeks, and if you see a predominant improvement of your symptoms, that's most likely you have lactose intolerance. You don't need another test. You might need some test later on to confirm and say, can I go back to some of these milk products and all that stuff? Or you can carry on with lactate supplements. Okay.
A question, Q&A?
Yeah, we can.
You seem to be like an expert on fatty liver.
Fatty liver. I talk a lot about other things too, yeah.
I recently came to know about fatty liver. I never knew that there is something called a fatty liver disease, or FLD.
Yeah.
One of my brothers got it recently. Does fatty liver disease lead to a pain in the lower back?
No. So the question was, what is fatty liver? Does fatty liver cause pain in the liver, pain in the low back? No. See, fatty liver is a very benign, silent process. So anybody can get fat in the liver, and you will not know it unless you do certain things. So if I check randomly all the ALTs of all of you, where ALT, by the way, is a liver enzyme. Okay. So if I do ALT of all of you, if anybody has a increased ALT and they are not taking any medications, they are not on any other, they have no other products, they have fatty liver, okay? Not only fatty liver, they have fatty liver with inflammation. So the process is, everybody's normal at some point, and then slowly with this metabolic syndrome that I was talking about, they start accumulating fat in the liver silently. How would you know it? Well, if you go and get an ultrasound for other reasons, and if the radiologist says you have a little bit of haziness on your liver and you have fatty liver, that's fatty liver, okay? Once you get it, the treatment is diet, exercise, weight loss, okay? But then when you have that, you can have elevation of your liver enzymes as a next side effect. That's non-alcohol fat liver disease, or NASH, non-alcohol hepatitis, steatohepatitis, non-alcohol fat-related hepatitis. That's something you want to keep an eye on, because that in the slow process can cause scar tissue in the liver. The scar tissue in the liver goes from 0 to 4. Each stage takes about 5 to 10 years. So if you go to a stage of 4, that's nothing but cirrhosis. Okay?
Basically, the subject had pain in the lower back,
Yeah.
kind of acute pain.
Mm-hmm.
So he went for a diagnosis, and then none of the physicians or doctors were able to exactly tell about the root cause. And then he went for a couple of those scans, and then on one of the scans there is like a whitish layer around the liver. So they said could be fatty liver.
Yeah, right. So see, fatty liver is silent. So if anybody says I have back pain, other reasons for back pain, 100%, because fatty liver is asymptomatic. So if they have back pain, they could be have spinal problems. Right? Arthritis is very common. They can have musculoskeletal symptoms and all that kind of stuff. Those are the common causes of back pain. But fatty liver would have been the incidental finding. Remember I said if anybody does ultrasound for belly pains and then incidentally the radiologist talks about that, you have it. It's silent though. Okay. Yes.
One of our family members, they have a lot of bowel movements in a given day, 3 or 4 or 5 times.
Well, that's a long topic. I mean, each is highly variable, right? So bowel movements, is for any particular individual is highly variable. Some people have once a day. Some people can go 3 times a day. Some people can go after each meal. Okay. In general, if they don't have frequent loose bowel movements, and with bleeding or urgency or frequency or weight loss or fever and cramps and stuff like that, they're mostly benign, especially if this person has been having this kind of stuff for a long time. But if that starts to bother them because they're so watery and loose, then we talk about common infections, especially GIDSs, which is a parasite. Okay, people who travel a lot, they can get that. Irritable bowel syndrome can cause that. Okay, there are lots of other reasons based on age group. Medications can cause diarrhea. Okay, some chronic infections can cause diarrhea. If it's associated with blood and all that, that's colitis. It's like they have ulcerative colitis, those kind of things. Those need formal workup. But it's just loose bowel movements 2 to 3 times, there are a lot of reasons for that. I mean, if they have lactose intolerance, they can have diarrhea, they can have, chronic infections, diet itself, depending on what they're eating, that can cause diarrhea. So I would say you can start off with high fiber diet first, because a high fiber diet increases the consistency of the stools, and then you can go from there.
So last question.
Are there any specific ways to bump up the HT?
Yeah, well, number 1 is exercise. Number 2 would be medicines like Lipitor, like statins, okay? Because most of the time it's genetic mediated, okay? So you can't change genes there, but you can increase it by regular exercise, and if exercise doesn't help, medicines like Lipitor, okay? Vitamin E, okay? Fish oil, sometimes are shown to bump up these cholesterol levels. And they're more so for triglycerides and LDL though, okay?
What kind of oil is good for eating so that you don't have heart disease and diabetes?
So people say, olive oil, okay, soy, okay, canola, those kind of things. So when we talk about all these fats, saturated fats are worst, okay? So when you look at these oils, you can look for polyunsaturated.
Ghee is bad.
Ghee is bad, yeah. And then you have to bake rather than pour oil. It's kind of hard. I mean, it's obviously we're used to a different system, but now coming here and learning that, we need to cut back everything, it's kind of a compromise. Okay, but then you have to be really careful because of the heart disease that happens in Indians. Okay.
Thank you.
Yeah, thanks a lot.